Greetings and salutations. Today is day 3 of Global Goals Week, Sunday, September the 19th. And I am going to be talking about Sustainable Development Goal number 3, good health and well-being. So, this is a very important topic. We, of course, all of us in the world know we're in the middle of one of the most significant healthcare crises the world has known in the last century. So clearly, Sustainable Goal Development 3 should be on the top of everybody's mind. When you think about it, the goal says we want to ensure healthy lives and promote well-being for all and all ages. That's the official thing. Again, ensure healthy lives and promote well-being for all at all ages. Well, clearly, we know what's happening now. And human well-being is more than just health as we tend to think of it. And it's not a random phenomenon. It really depends on many factors. Sam Harris says it ranges from genetics and neurobiology to sociology and economics. But clearly, we know there are also scientific truths to be known about how we can flourish in the world. And so that's what we are talking about. How do we create a flourishing world through healthcare? Now, think about this. SDG 3 has 13 targets and 28 indicators to measure progress from those targets. And these targets range from a reduction of maternal mortality to ending all preventable deaths of children under 5 years old, fighting communicable diseases, promoting mental health, reducing road injuries, granting universal access to sexual and reproductive care, family planning, and achieving universal health care coverage. Now imagine, envision 2030, if you will. And for me, my headline would read, African health sector is all into win, with Africa now achieving 90% of the population having access to health care by telehealth and a truly innovative microhealth insurance scheme. Now, you might say, it's a little bit far-fetched to think we're going to move from where we are now to where this headline says in 8 years. And maybe it will take more than 8 years. But let me tell you, I truly believe that the future of health is bright. We know that there are 10 archetypes that are defining the healthcare ecosystem of the future. And they're about data, and platforms. It's also about the issue of how we deal with well-being and care, as well as how we deal with consumers or the healthcare practitioners themselves. And there is so much happening in this space that it's a lot to take in. What I want to say simply is that we know that as we think about the future of health and the future of well-being, that with the African diaspora being so involved in healthcare in the United States, in Canada, and in Europe, and even as far as Australia, the hope for African healthcare to leapfrog its challenges and make it to a winning relay is very high. All right? Now, here's a seed of hope that makes me notice so. Diaspora Care. Diaspora Care. It is an organization founded by African diaspora members in the United States of America. I first met one of their co-founders in April of last year, Jote Tadese, and I was so excited by the vision that they have for transforming healthcare in Africa. Clinic in a Box, which is going to be provided at near cost to doctors in the region, and provide supply chain management and financial management and patient and clinic management. Pharmacy in a Box, very similar. And more importantly, a healthcare financing app that allows the African diaspora to pay directly and contribute to the care of their family at home, pay for pharmacy, pay for clinical care for those who looked after their loved ones back home. So you see, this headline may not be as crazy as it seems. I believe that we can give a shout out then to Diaspora Care as our seed of hope for SDG 3 on good health and well-being. I know that we create our future ourselves, either through default or through design, right? And Smart Futures is about creating it through design. And Diaspora Care is a great example of a Smart Futures approach to providing a solution to the problem, because they've taken care of the sustainability question, the metrics question, the agency question, the resilience question, and the technology question. Shout out again to Diaspora Care and my friend and colleague, Jota Tadese. Walk good, everybody. Onwards, Ubuntu.